The inversion table or back traction is often given as a treatment option for back problems like herniated discs, back stenosis, lower back arthritis, and muscle spasms in the back. But does the treatment really help? How is it used exactly? And does it work in the body? That's what we're going to talk about in this video. I'll give you my honest opinion as a physical therapist about inversion tables or traction units. I will also be answering the question, is an inversion table helpful for the back? But first, let's talk about how traction or inversion therapy works for patients. When we're looking at inversion tables or traction, they're really one of the same. What the traction unit does is it uses pressure to kind of pull the spine apart. So it's like it just pulls the spine apart like this, giving us more room back through here in the facet joints, giving us more room in that disc. So if there's kind of like disc problems. And the same thing happens with an inversion table, except your feet are hooked in and you're using the weight of gravity to kind of pull your body apart. Now, does it work? So I would say no. Like, it can work for a temporary solution, and here is why. Because if you go and you open up the space, it's gonna feel a little bit better, but our body is meant to move. And you've all heard me talk about like stenosis or have talked about herniated discs, where you can actually use motion or positions to start improving that mobility. And that really is why. Like, we can give you exercises that are gonna do way better at solving your problem of back pain, stenosis, herniated discs than using an inversion table. And the reason why you go in and you're giving the traction out like this, so it's going to open up the space, but then gravity takes back into effect and you have the exact same problem that you had before. It doesn't really help, like if it's a stenosis issue or a disc issue, a lot of times it comes from like this disc, it moves around, things can get like dislodged, or let's say it's a joint and you're opening up the joint space. But if we can go and get the joints to kind of move in a way, because usually we can find a position that will get those joints to open up or those joints to stretch, that's going to do better than just a pure motion like this. So if I want to get someone with stenosis and it's really truly stenosis, we can start putting their body on like a pillow to kind of open up the space in the back a little bit. That's going to open up those facet joints. That's also, and then we're going to slowly reverse it to where we can get those joints to move in the opposite direction, or get those discs material to move in the opposite direction, to move everything away. And that's why I say movement is key. There is certain movements that can open things up, and with traction, you're just going straight, and then you're coming right back down, and gravity is going to set in. The activity that you're going to be doing throughout the day is going to set in, and so there's a lot of things that we can do. Now, for the back, have I used traction before? Nope, never needed it. For the back, I've never had to use actual traction to help solve someone's case. Now, for the neck, a little bit different. I have had to use it a little bit, but a lot of times we can, within one visit or so, we can get them moving enough where they now actually can move and get better. And so that's where I'm like, it's a static treatment where we're not doing anything. You can't do it at home. The inversion table you can. I guess traction, the traction units for the lumbar spine, really hard to find something that you can actually use at home. But I'm here to tell you, you could actually do exercises specific to what's going on in your back that's going to solve your problem much quicker, much faster, and giving the education as to like, what are you doing throughout the day that's creating some of these things, because we have to go into your lifestyle to understand that piece of it to also help. So if you just do traction alone, it's really hard to get those results. If you just do the inversion table alone, you'll feel better after getting off the table, but your symptoms are going to come right back again. And yeah, you can do it again and again, but here's some problems when you do the inversion table. If you have any kind of blood pressure issues or eye issues or any headaches or any kind of thing that you don't want the blood to flow to your head, you're not going to be able to do those things. And even if you were, vertigo is another one, but even if you were, you literally, we can get you better results by doing movement type things to get those joints to start moving, to get the discs to start moving in a better position. So I say, with my personal opinion, no, don't really need the traction tables, don't need the inversion tables. There's things that you can do that will work way better. There's other videos that you can learn from us to start understanding your back pain a lot better from all the conditions that we talked about. And so that's what I say. So if you like what we're saying and you want to hear more, because we're always putting content out all the time, make sure you subscribe to our channel. If you have any comments, comment below, and we can answer any of your questions. If you're having any kind of back pain, definitely go into the comment section. You can ask questions there. In the description, we have resources for you, so you can learn more about how you can work with us, or other free resources, as well as my book that I published a year ago, which is a huge resource. Been getting a lot of people just enjoying reading that and understanding their body a little bit better. So yeah, those are things that you can do as of now, and we'll see you next time.